Hello, I'm Dr. Douglas Carpenter. I'm a doctorate level clinical psychologist in the state of Michigan in Auburn Hills. And if you're a pastor or in leadership, I just wanted to bring some words to you today to help you with grief and loss and helping your congregations or people that you're leading through the process of grief and loss. In our current society, in our world today, grief and loss has become a paramount. It's huge. It's a huge issue with so much loss going on around the world. And I wanted to just leave you with some information and some basic tips that might help you. A couple things that I want to mention first is just some basic information, and that is a concept of universality. Universality is a concept that was termed and coined by Irving Yalom, who is considered the father of group therapy. And he said that once a person comes into group therapy, that part of the dynamic and the interplay that happens there is that other members of the group begin to look at other members and realize I'm not the only one with this problem, that we're all in this together, that the feelings and the emotions that I'm going through, the behavioral changes that I'm going through are congruent and very similar to other people in the group. And that's a termed universality. So you need to help people understand that universality is something that's occurring with all of us right now around the world, that we're all in this together. We're all experiencing some degree of grief and loss. Another thing that you can do is really encourage them to limit the amount of time that they're watching the news or information from social media that's impacting their overall emotional state and possibly even complicating their sense of loss and grief. Some of you may be familiar with this first information that I'm going to review, but Elizabeth Kubler-Ross was a psychologist who came up with the 5 stages of grief and loss. And I use a short acronym to remember this: DABDA, D-A-B-D-A. And that is the first one. The first D is denial. And we all kind of know what denial is. It's a sense of disbelief. It's an emotional and intellectual rejection of the idea or the news that you've just received. The next stage, the A, so we have denial, anger, is the second stage. The person may become very angry about the event that has transpired. They may be angry at themselves. They may be angry at the person who they've lost or the person who fired them. They might be very angry at God for allowing this to happen and assure them that God has big shoulders. He can handle their emotion. They may be angry at doctors, healthcare workers. They may even be angry at China. They may be angry at the government for how this was potentially handled and whatever their political thoughts might be about that. So you're going to have to deal with the person's anger, and that it's okay for them to be angry. They have a right to their anger, and emotions aren't bad. It's what we do with them that can be bad. So assure them of their anger, that this is normal at this time. The next stage is bargaining. And this is where the person might say, if only I'd have done this, then this wouldn't have happened. Or if I'd have done this, this would have happened. So there's going to be a lot of back and forth in their thinking and believing that they actually had some sense of control over the situation. It's really important that you help them recognize what was within their control and what was not within their control. And that we have to accept in life that many, many things are not within our sense of power, of control, and that we eventually have to let go. The next stage is depression or despair. That's a sadness. They may feel hopeless at this time, feeling that everything is lost, nothing will ever be the same again. Again, those feelings need to be validated, but they also needed to be followed up with a sense of hope. That we do serve a risen Savior. He is our comforter. He is with us. We will get through this. There will be hope again at some point, and that will help them move to the level of acceptance. And that is just understanding that they had no control over the situation, that this played out the way it is. God's ways are higher than ours, and that we just have to come to a place of acceptance and move on with life. So let's talk just a moment about job loss and financial loss. There's a lot of people, like 7 million people right now are on unemployment or trying to get unemployment through the government because they have lost their jobs or their ability to earn an income. And losing a job can be just as painful and stunning and shocking and difficult as losing a person in your family. A lot of us, especially men, define themselves by what they do in their jobs. So that can be a huge loss. So just recognize that job loss can be a very significant thing. Validate those feelings for them. Help them process their feelings about having lost my job. Walk them through DABDA, the 5 stages of grief, about these feelings of loss. Encourage them to stay connected to their employer and their employees. There's a strong indication that once we're through all this, that life will return to normal. People will return to jobs. They will be called back to jobs. They'll be rehired. Assure them that we are going to get through this, but have them stay in contact with their employer and their coworkers, and let their employer know that they want their job and that they're still interested in working for that job and that company and that employer. Discuss with them the potential need for them to cut their expenses, to formulate a budget, and to apply for unemployment. If you have someone in the church that is good with financial information, maybe connect them with that person to help them formulate a new budget or figure out where they can cut expenses for the current time. A lot of people are going to be really stressed out and worried about how we're going to make it through this time. And again, go back to that sense of universality, that we're all in this together, and help them to recognize this is a temporary problem. Just like in the sense of suicide, I try to tell people who are contemplating suicide that is a permanent problem, permanent solution to a temporary problem. And so help them recognize that their job loss situation is very temporary. The economy was doing very well before this hit and has a good chance of bouncing back, and they will regain their employment. Now, here comes the complicated piece, and that is something called persistent complex bereavement disorder. And this is a disorder, we're going to term it a disorder from the Diagnostic and Statistical Manual of Psychology or Psychiatry. This is when grief lasts more than 12 months. And the reason I'm jumping right to this is I think that we are going to see a very strong upsurge in this concept and this disorder over the next couple of years because of the way that this pandemic is playing out. People are going to be left with a lot of complex bereavement. The first step of this is something that we just simply call narrative therapy. And this is just allowing the person to tell their story, to talk about the person and the person's life, and for them to talk about their experiences with this person and what they're feeling now. A lot of times it's not about what you say, it's that you listen, that you sit and have a comforting, listening ear of assurance to this person and give them time to tell their story. The problem here with the current pandemic is that people are not getting the chance to say goodbye to their loved ones, that their loved ones are dying alone in hospitals, in nursing homes, in skilled care facilities. At best, there may be a nurse there holding a phone up next to the person if they even get that chance to say goodbye, or if the person was even conscious. This leads to something called ambiguous grief, which is part of a very complex form of grief. And an ambiguous grief occurs at a loss that occurs without closure or a clear understanding and leaves the person searching for answers. You're going to hear a lot of why. Why did this happen? Why did this happen in this manner? Why did this happen the way that it did? Why did God allow this to happen? So there's going to be a lot of ambiguous grief. People are going to be searching for answers. They're going to feel a lot of despair around the fact that people died alone and that people did not get to say goodbye. Just about 5 or 6 steps that you can do to help this process is: number one, recognize that it is ambiguous grief and label it that. Give it a name. Let the person hear you say, this is ambiguous grief, and this happens when we don't get closure. We don't get to say goodbye. So label it for them. Make sure that they have some support around them, that they have a supportive network. Number two is beware of the anger and the guilt. In ambiguous anger or ambiguous grief, there's a lot of anger and guilt. Anger that this happened, guilt that I couldn't be there, guilt that I couldn't do anything. There may be a lot of bargaining going on in the stages of DABDA. And you're going to, again, have to help them recognize what was within their control and what was not. And what power did they have over the situation? Was it even a realistic event that they could possibly even say goodbye to this person? Assure them that their feelings of guilt and anger are completely normal and that they will eventually go away as they move toward a level of acceptance. Help this person revisit the roles in the family. Because of the loss of this person, things are going to change within their family structure. There may have to be a new division of roles and responsibilities. And when they're ready, help them examine that. How is this family dynamic going to change in relation to having lost this person, and what do we need to do to bring homeostasis, to bring balance to this family system now that this person is going to leave such a deficit in the family structure? Number 4 is balancing your thinking. Recognize the loss, but also recognize that life will continue and it will be reestablished. They will find a new normal. Be very careful how you say that to them, to not discount their feelings of grief, but say it in a way that you can offer hope. Again, I'll use the example of suicide. You can say, have you thought about suicide? That sounds like I'm suggesting it. If I say, have you thought about suicide? That can, with more empathy, that can be asking a question in concern. So be careful how you represent this stage of bringing a sense of hopelessness to the person, so that the way they can grasp and understand that you're telling them this in a caring, loving way, helping them to look at the future, that there will be hope. So on one stage, you're gonna help them vacillate from activities of loss and then activities that are more restorative. So in the loss phase, you may sit with them. They may look at pictures. They may use narrative therapy to talk about the person. They may cry a lot and allow them to cry and comfort them through this, but then move them on to more restorative activities. What are their personal dreams and goals for the future? What are their family goals and dreams for the future now without this person? And what might that begin to look like? So then renew hope. And that's part of that restorative activity. What are their dreams? What are their goals of moving on in the future? Then number 6 is help them look at themselves and what strategies of self-care are they using. Help them, encourage them to practice and maintain a regular sleep-wake cycle, a regular eating habit, schedule. Are they continuing to exercise? You must encourage them to take care of themselves. Also, it's important for parents who've lost a spouse here, who are still raising children, that these children have lost one parent already. They can't lose another parent due to extreme complicated bereavement. That the person help them work through these stages and get to a place where they can love and parent their children in the absence of their spouse. These children can't afford to lose 2 parents through this process. So help them look at their self-care strategies, help them maintain that, help them formulate schedules. My last point is more of what we would call symbolic or cathartic type work. Since this person did not get the chance to say goodbye to their loved one, you may have to employ a few different strategies to help them. One thing that we do in therapy is set up an empty chair, have them imagine that person is sitting in the chair, and actually go through the work and say goodbye. You may have someone in the room, for example, if you were in group therapy, sit in that chair and take the place of that deceased person while that person has the chance to say goodbye. That might be a little more difficult if you're not in a therapeutic setting. In a more normal setting, one thing you can do is have the person write a letter of goodbye to this person. Assure them that this person knew how they felt about them, and they can write all that in the letter. Then they can choose to do whatever they would like to do that would feel cathartic to them regarding the letter. I've had some patients who will take the letter and then tie it with a string to a helium balloon and go outside and say a prayer and let it go and let the balloon ascend into the heavens, as if this balloon is taking their message to heaven, to the person that they need to say goodbye to. So help them find some symbolic way for them to take this letter, say goodbye. Right now it's kind of difficult to have funerals or to have a gravesite to visit once we lose someone. So that's going to add to this ambiguous grief and this complex bereavement disorder, that there's not an actual place to go visit where they could go talk to this person, say goodbye to this person. You could also encourage the family to do something right now to commemorate the person, since they're probably not going to be able to have a memorial service. Maybe they can do some type of commemorative service. Maybe they can do some kind of commemorative activity, have a Zoom meeting online, inviting family, friends, relatives of this person to just say a few words about what this person meant to them and that they're there for the family. But help the family do something commemorative. They may want to set around a table with a candle with dim lighting and just sit and meditate or pray and just think that, that their thoughts can reach heaven, to either God or to that person, and that those thoughts can be delivered to that person. This brings about some inner healing that the person needs within themselves to be able to release their tension and grief and sadness and despair about being able to say goodbye. Undoubtedly, these are very, very, very difficult times for pastors, leaders, social workers, licensed therapists, licensed counselors, psychologists. This is a difficult time for all of us, and we're going to have really broad shoulders to help people through their grief. Another thing that you might look into when this pandemic is over is there's a program out of Texas called Grief Share. I know our church has Grief Share, and we run that a couple of times a year. It's like a, 18 to 24 week program around grief. It may be very important for many churches to implement Grief Share once we're through this, to continue help people process through their grief. So my prayers, my thoughts are with you as leaders, that you can continue to help people through this stage of loss and grief, and that God will give you wisdom, that God will give you the strength and the power to respond appropriately to your own sense of grief and loss. And we know the great physician, and that he can heal our grief and loss. Thank you. Have a good day.